All right, let's dive into one of the most fascinating and kind of terrifying paradoxes in all of medicine. We're going to unpack the very strange case of hepatorenal syndrome. It's a wild story where the body's own survival instincts, well, they go completely haywire. So let's just get right to the heart of the mystery, shall we? Picture this. A patient's kidneys are failing, and fast. They are shutting down. But when doctors take a look, really look at the organs themselves, they find absolutely nothing wrong with them. No damage, no disease, nothing. So the big question is, how on earth is that possible? And that question right there brings us to the first part of our story, this incredible medical paradox. And this isn't some new puzzle we just discovered. Nope. This is a situation that had researchers scratching their heads for decades. So here's the deal. The official name for this is hepatorenal syndrome, or HRS for short. It's a life-threatening condition where someone with really severe liver disease, their kidneys just suddenly fail. But the key word here, the most important word, is functional failure. It means the kidneys aren't actually broken. They've gone on strike.
And this is what made it so baffling for so long. Early on, doctors would see this happen, kidneys failing. But then, in autopsies, the kidneys looked totally normal. And here's the real mind-bender. They could actually take a kidney from someone who died from HRS, transplant it into someone else, and bam, it would start working perfectly. So right then, they knew the problem was never, ever the kidneys.
So if the kidneys are totally fine, what in the world is causing them to shut down? Well, that leads us right into the next piece of the puzzle. It all comes down to the body having a massive, and I mean catastrophic, overreaction. Think of it like a chain of dominoes, and the first one to fall is a failing liver. That failing liver causes blood vessels all over the body to just open up, get super wide. And when that happens, your blood pressure plummets. It's a nosedive. The body, of course, absolutely panics. It hits the big red emergency button. To try and get that pressure back up, it starts clamping down on blood flow to areas it thinks are less important. And tragically, one of the first places it cuts off is the kidneys. And when I say the body panics, I mean it calls in the cavalry. We're talking about its most powerful emergency systems, the renin-angiotensin-aldosterone system, we just call it RAS, and the sympathetic nervous system. These are basically the body's SWAT teams, the fight or flight responders. Their one and only job in this crisis is to crank up blood pressure, no matter the cost. And here's the tragic consequence of that all-out emergency response. It's a thing called renal vasoconstriction, which is a fancy way of saying the body squeezes the blood vessels going to the kidneys so hard that it completely chokes off their blood supply. So now you've got these perfectly healthy kidneys that are literally being starved of blood and oxygen. And what do? They just shut down. Now, you might be wondering what actually pushes a body that's already in trouble over the edge. Well, it's usually some kind of trigger event, a major infection, something called spontaneous bacterial peritonitis, or SBP is a big one. Or maybe a major gastrointestinal bleed, or even just a procedure to remove excess fluid. Any of these can be the final straw that sets off this whole devastating cascade. Okay, so with a mechanism this bizarre, how in the world do doctors figure out that this is what's happening? Well, it's not easy. It's what they call a diagnosis of exclusion. Basically, a process of elimination. Yeah, there's no single blood test you can run that just screams hepatorenal syndrome. It's not that simple. There is no single test for it, and that makes diagnosing it a huge challenge. Doctors basically have to become medical detectives. So, to get to an HRS diagnosis, they have to rule everything else out first. Is there any structural damage to the kidney? Nope. Is the patient in shock from something else? Nope. Are they on any drugs that could be toxic to the kidneys? Ruled out. Is there a blockage, an infection? No, no, and no. It's only after they've crossed every other possibility off the list that they can finally land on hepatorenal syndrome. And once that diagnosis is made, the clock is ticking. It becomes an absolute race against time. So let's talk about how doctors fight back against this total system shutdown. First off, it's important to know there are two main types. You've got HRS-AK, which stands for acute kidney injury. This one is the fast and furious version, a really rapid, severe decline in kidney function that happens over just days or maybe a couple of weeks. Then there's HRS-AKD, or acute kidney disease, which is a much slower, more gradual decline. But as you can probably guess, that first one, HRS-AK, is a massive medical emergency. And when I say emergency, I mean it. For untreated HRS-AKI, the median survival time is about 2 weeks. That's it. This is not a chronic illness we're talking about. This is an incredibly acute life or death crisis. So the treatment strategy really has 3 parts. First, there are the medical therapies, which are all about fighting the body's overreaction. Then you have interventional procedures that act as a kind of bridge. And finally, there's the definitive treatment, the one that actually cures it. Okay, so the immediate response is to hit the patient with powerful drugs called vasoconstrictors, along with a protein called albumin. The whole goal is to fight fire with fire, to manually counteract that crazy vasodilation and force the blood pressure back up to get blood flowing to the kidneys again. Another really clever option is a procedure called TIPS. It's where doctors create a shunt to reroute blood flow and relieve the pressure on the liver. It basically tricks the body into thinking the crisis is over so it can call off the alarm. But here's the thing. All of these interventions, as amazing and life-saving as they are, they're not fixing the root problem. Which brings us to the final act in this story, the ultimate solution. And we need to be super clear here. The drugs, the TIPS procedure, they are brilliant. They buy precious time, maybe weeks, maybe even months. But they are a bridge to somewhere else. They are not the final destination. They're only treating the symptoms, not the actual cause of the whole mess. And this is the bottom line. The only way to truly cure hepatorenal syndrome is to go back to that very first domino. You have to fix the root cause of the entire problem, which is the failing liver. A liver transplant is the one and only definitive cure. And here's the final, amazing twist that closes the case on our mystery. Once a patient gets a successful liver transplant, the body's frantic emergency signals just stop. Blood flow goes back to normal. And those kidneys that were failing, they often just wake right back up and start working perfectly again. It's the ultimate proof that they were healthy, innocent victims the entire time. So, we'll end with a pretty profound question to think about. Hepatorenal syndrome really makes you wonder, doesn't it? In its desperate attempt to save itself, can the body sometimes become its own worst enemy? It's a powerful reminder that even our most basic survival instincts can sometimes lead to devastating consequences.